So, hello all. I would like to have your attention for a while. Thank you. So, it's a very pleasure to us to receive all of you to have the kickoff of the XiA project that is Xpanding Innovative Alliance. So it's our pleasure to have everybody here to this moment, and also to start our meeting. And also is an open session that is starting online. I would like to invite the Vice Rector Jorge Costa that will give the first introductory speech on the day. Thank you so much.
So, good afternoon. My name is Jorge Costa. I'm currently Vice Rector of Iscte for Research, and it is a pleasure to welcome you all here. I must start for apologizing for the weather. We are most famous for our sunshine weather, and unfortunately we had the very rainy day, but hopefully it will get better in the evening, I suppose. So for us, Iscte is always very important, these initiatives. And I must start to thank all, in particular to the members of the Iscte community that had the spirit of collaborating with all our partners, longtime partners, in creating this new project, this Erasmus initiative, for a very important topic as my point of view. So I hope that you have a very productive, I think, couple of days. And I hope that from these new initiatives can be created and intensify this long-term collaboration that we are always open to receive and to participate. Thank you all for being here.
So thank you so much, Professor Jorge Costa, for the starting. And now I would like to invite the Policy Officer, Thyra Jart, to have also a speech about the policy contentment of the project. So thank you so much. So. Thyra, I would like to invite you to open your camera and also share your slides.
Yes, sorry. I have an issue with Cristina is trying to come in. So if you could send her an invite while I'm speaking, because she cannot get in right now.
Okay, thank you.
Yeah, super. Thank you.
I just managed.
Okay, super.
Thank you very much. Thank you.
Good. I will start. I'm sorry for the delay. And here we should go. And I hope it's in presentation mode right now. Can you confirm?
Yes.
Good. Thank you so much for having me here. My name is Thyra Jart, and I'm a policy officer with DG-SANTE in Brussels and with the digital health unit, and I'm a second national expert from Denmark. I will try in brief 10 minutes to give a very quick introduction to the European health data space and especially what is set on skills. But because there could be some people in the room who have not really been into EHDS, I will do a brief intro first. So what is the European health data space? It is 3 different pillars. It's the primary use of data, so the data we use for actually giving healthcare and for securing that healthcare can continue across healthcare providers and also across borders. Then we have secondary use, which is data that is used for research, or it could also be analysis done by the Ministry of Health or other authorities for policymaking, etc. And this will also be data across borders, so you can do your analysis not only on the member state data, but also on other countries' data. Then the third pillar is opening a single market for the for the electronic health records system, and this is understood very broadly. Where I come from, electronic health records are usually in the hospital, and then we have other names for many other records, but here it's quite broad. And it's by standardizing these systems, having requirements for them so that you can basically change your system as a hospital or a healthcare provider without too much trouble. And this is, I think, the part of the HDS that is most interesting for the people in the room. So I'll go through very briefly primary use. I will not talk about secondary use more during these 10 minutes. But I'll try to very briefly say what primary use is. That's also what I usually work with. So how does the European health data space approach primary use? It gives rights to the citizen. And these rights are stated here. It's access to health data. It's the right to download a copy of your data. It's to view who has actually accessed your data, and also to set access restrictions. So for example, is your neighbor a doctor and you do not want him to look at your data, you can restrict him. It's also opt-out. So if you don't want to share your data between healthcare providers, that's also an option, depending a little on the member state decision. And then there's the information that you can yourself as a citizen insert into your EHR. And then finally, you can give proxy to someone. It could be if you're old and you want your daughter to take care of stuff, then you can give proxy to her. And then finally, you can have your data corrected if there are any errors in it, and you can do that also digitally. So for all of this to work, you need to set up some kind of interoperability, and you need to have specifications and requirements to make it work. And that's what EHDS, or at least the primary data part and the EHR part is about. So what kind of data is included and focus of the EHDS? There are two groups of data. We call them priority categories. The first group is patient summaries, and then electronic prescriptions and dispensations. And that group of data should be up and running 4 years from the time when we, when the regulation is put into force, which we're expecting very soon. Then the second group of data is imaging, and it's medical test results. And this is broader than just laboratory tests. So that's important to understand. And also it's discharge reports. And discharge reports are also broader than just hospital discharge reports. And that group should be implemented 6 years after the regulation is put into force. So one could ask, is this all new? Do we need to invent it from scratch? No, it's already existing in a voluntary network. So 15 member states are currently live with one or more services, exchanging, for example, patient summary or e-prescriptions. And just in 2025, we're expecting up to 10 more countries to go live. So there is something to build upon. And that's also why the format that you will be working on is not just something, we talk about. It's something that is actually working right now. So what are the requirements for the EHR systems? Yeah, there are two main components that are being harmonized, and it's the interoperability component. And if you have your regulation just in front of you, it's Article 15, and it's the locking component, which is Article 9. And then there's also some security. There needs to be security. So these two are the the components that are harmonized, and these are the ones that all EHR vendors need to understand and need to implement and need to have tested and need to document that they have implemented. So what is this exchange format? I've taken a part of Article 15 just to show a little of what it is. And if we go down to the A, B, and C, and I don't know if you could see it, but then I'm sure you're getting the slides afterwards, you can see. But some of the things that I mentioned is that it's harmonized data sets and it's defining structures such as data fields and data groups for the representation of clinical content. And it's also coding systems and values. So this is very particular. And then the technical interoperability specifications for actually exchanging the data. And here, I'm sure many of you know both standards and profiles that can be used for that. So this is the format. Then what does EHDS say about skills? I had to look it up to be sure. And it says the following. For healthcare professionals, there's Article 83, and it requires that training programs are put in place by the member states. And this is, of course, to also make sure that the health professionals can carry out their roles and understand what the ethics and everything around dealing with healthcare data when you start sharing it across both borders and between healthcare providers. And we hope when we look at this that also the XiA project will be able to support some of this. I know it's not the main focus, but could also support some of this. Then for patients, it's very much about digital health literacy. There's also actually something on it for health professionals. But of course, you cannot digitalize so much and give a lot of rights to citizens unless they can actually use them. And that means they need to have some kind of literacy in using these systems and understanding what they can do with the access they're given. And also here we hope that the XiA, I know, again, it's not the main, but I think that you say that indirectly you will also support this as far as I remember. Then for technical skills, which is probably more what is in focus for you, I went to the preamble to see what it said. And it actually talks about the digital health authorities having sufficient technical skills. But it also talks about both digital health authorities, but also those who procure systems, that they should apply common standards and specifications and also should promote the application of standards and specifications in procurement. So here we're going from health professionals and citizens to the more technical people, but also people who may not necessarily be the IT technical people, but the people who have to make the decisions on what to buy. So it's important that everybody understands that what are the standards and specifications needed to ensure the interoperability. So both for, we have, like I said, the first group of data categories is within 4 years from the time the regulation is put into force. And that means that every single vendor who wants to be on the market and every single healthcare provider who needs to support the citizen rights needs to look at their systems, determine what needs to be updated, what needs to be changed, and then have a plan and get it into the release plans so that they can live up to the regulation in 4 years. And this, of course, creates a big need for quickly having organizations and also industry to understand what the format is about, what the requirements are, so that they can plan, but also it's not only about IT technical expertise, as it is also an area where you need to speak to healthcare professionals because you're using coding systems. You may need to look at the workflow and how it impacts their daily life. So there is a big skills need. So for this year, we are very happy that you are supporting this transformation. And I took one of the expected outputs of the XiA project, which talks about an output of large number of educated workforce and health and IT provider organizations in advanced interoperability standards related to the EHDS requirements and future needs. And that's exactly what we need. And as both healthcare IT skilled resources and also healthcare professionals are a scarce resource, it's very important that we get as large a pool as we can of skilled people in this area across the EU. And in our DG-SANTE, we are looking forward to learning more about the project, and we are eager to follow it and see the results. I have a couple more slides, and those are just for info because I think you probably want to jump into timelines and so forth at some point. So here is the timeline for the EHDS, and EIF is when it's expected to go into force. And then you can see the deadlines for the commission work is in 2 years. Then we do the implementing acts, and that means we have the final specifications. And after that, the final specifications are in place, and it can be, all the systems can be modified and after 4 years live up to it. And then the last slide I have are some open webinars. I hope this is shared. Otherwise, you also, for the coordinating team, you are open to sharing this on LinkedIn or other platforms that you have. And the first webinar on EHDS is on the 18th of February. Thank you.
Thank you so much, Thyra, for the nice presentation and for the presence here. Thank you so much. We also are eager that you, the DG and other European Commission bodies are eager to know a little bit more about XiA and also follow our work, and I hope that we can correspond our expectations. And thank you so much. And now I would like to invite our project officer, Cristina Camaiani, that will give a speech regarding about the project management and monitoring. And this is the point. So,
and can I ask, didn't I have a second point from the employment? Or did you?
Yes.
Or not?
Sorry, I didn't understand.
I took over a presentation from my colleague, Sonia, and I thought I needed to give that also.
Yes, yes, please. Sorry.
Okay, sorry.
I'll finish it. Sorry.
Yes, yes, there's a presentation about the Pact of Skills
Yeah,
before
exactly.
my presentation.
So,
yeah, please.
Okay, I'll give that now, and then I'll hand over to you, Cristina, afterwards.
Sorry, this is misunderstanding.
No, it's fine. Good. Then I'll go straight to that, and apologies for my colleagues in DG Employment, Social Affairs and Inclusion for not being here. They already had a commitment they had to attend to. So I have been given instructions by them, and will give it to you. And as you are all aware, skills have been a priority for the Commission during the past years, and this will continue in the future. Chronic skills and labor market shortages and aging population, plus the need to make the green and digital transitions a reality, mean that skills will remain a high priority for the Commission. I'll come back to that later. This is all the more urgent in a context where Europe needs to become more competitive, resilient, autonomous, and more socially inclusive. And the Letta and Draghi reports recently highlighted prominently how crucial skills are to our competitiveness and to people's prosperity and well-being. At a time of tight labor markets, employers are giving greater prominence to skills. More employers are using skills-based approaches in recruitment and career development, and these require a true lifelong learning culture.
Sorry to interrupt you.
Mm?
Maybe do you have a slide to share?
No.
On this? No, there are no,
No.
slide in this for the access skill. Okay.
Yeah.
Just to be sure that we're not hidden.
No. It's
Okay. Thank you. Sorry.
Yes. Indeed, in the future, most people, once they will have completed their formal education, will spend some 40 to 50 years in the workforce. The pace of change, including constantly evolving technology, is extremely rapid and will continue to be so. So upskilling and reskilling need to be the new normal for all adults, and everyone will need to learn through their entire lives. Skills systems must therefore adapt and be more flexible, both in terms of delivery and in terms of better tracking new skills learned along the way and acquired in new ways, both formal and non-formal. The EU skills agenda has been our key strategy in the skills field since 2020. A great deal has been achieved through its 12 flagship actions. It has led to individuals gaining new skills, which need to be made visible and trusted so that people can reap the optimal benefits from their learning for both labor market needs and for further learning. Despite the efforts made in recent years at EU and national level, skills challenges continue to exist, and new challenges are arising. We see that across member states, we are still far from reaching the EU headline target of 60% of adults taking part in training each year. Currently, the level is estimated at only 39.5% on average. And here the Pact for Skills come in. In the health ecosystem, we already have 3 Pact large-scale skills partnerships, one focusing in the health workforce, another one focusing on the care sector, and a third one focusing on the pharmaceutical industry. A regional partnership was also established in Italy, the Promis Salute. In addition to XiA, 4 other blueprint alliances are being implemented. There's the Blueprint 2021 called Be Well, the Blueprint 2022 ELDICare, the Blueprint 2023 Care for Skills, and then finally the Blueprint 2024 Bright Skills. Almost all skills partnerships have joined the Pact are building or want to build on blueprint alliances. This is a win-win situation. For the following reason, the Pact for Skills partnerships do not need to start from zero, but can build on concrete results. The blueprints can disseminate their deliverables within larger Pact partnerships. There are also links to other policy frameworks, such as regional smart specialization strategies. And the Pact is here to stay. Our former and new president has acknowledged the challenges, which is why skills appear prominently in her political guidelines put forward this summer. And I quote, "Europe needs a radical step change in ambition and action for all skill levels and for all types of training and education. This is as important for people's careers and prospects as it is for our competitiveness. To do so, we will establish a union of skills, focusing on investment, adult and lifelong learning, skill retention, and the recognition of different types of training to enable people to work across our union." End of quote. The choice of words, bringing together union and skills, shows the high priority given to skills. It implies that Europe should be seen as one single pool of skills where everybody can acquire skills throughout their life. All skills are valorized, irrespective of how and where they were acquired. The Union of Skills will aim to make these 2 conditions real. With regard to our Commissioner, Executive Vice President Roxana Minsato, skills have been promoted to the headline of her portfolio, which is People, Skills and Preparedness. And in her mission letter, she has been tasked explicitly, amongst other things, to develop the Union of Skills. To ensure the right skills development, the Union of Skills will include a European strategy for vocational education and training, building upon the 2020 Council recommendation on vocational education and training. This will be complemented by actions within the European education area, such as an action plan for basic skills. Once developed, skills need to be put to good use anywhere in the EU. The Skills Portability Initiative will have this objective to reduce barriers to labor mobility, supporting people in their career and companies to recruit talent. We don't start from scratch. The Union of Skills will build upon the European Skills Agenda, take advantage of the intensive debate with stakeholders during the European Year of Skills, and bring forward the European education area. Such initiatives as the blueprints, the Centers of Vocational Excellence, and the individual learning accounts will be continued and reinforced as appropriate. As part of this, she has been asked to build on the work of the Pact for Skills to develop large-scale partnerships to upskill and reskill more workers in key industrial ecosystems. This is excellent news for the Pact community and confirms that work you have been doing is seen as contributing to solutions to the problems I highlighted at the start of my intervention. To conclude, soon discussions on the post-2027 EU budget will also start. As you know, key support for our action stems from the European Social Funds Plus and Erasmus Plus blueprints. We will closely follow this discussion to see how best to continue supporting your activities. So keep tuned in. Thank you from my colleagues.
Thank you so much, Thyra, for also this presentation. Unfortunately, our invited person, Sonia, cannot be present, but like you have a very good speech. Thank you so much for this. And now, finally, I invite Cristina Camaiani, that is our project officer from XiA project. And she will give a speech regarding the project management and also monitoring. And thank you so much for accepting our invitation.
Thanks to you. Sorry, I had some problem of connection at the very beginning, but then I managed to join you. Can you see my slide? Yes. Okay, very good. So I am the project advisor in charge of following up your project here at EACEA. And I will give you now a presentation concerning monitoring, continuous reporting, and useful tips and info on following up your project. So first of all, I will give you some information about our agency, what we do, where we work, the action under which your project has been selected, and about the monitoring continuous reporting. So how we monitor the project implementation and what is required to you for a continuous reporting and periodic reporting. And also the importance of deliverables and visibility and disclaimer for your project, especially considering that this project is a project based on lump sum, so not budget based, it's based on lump sum. So, but now starting briefly, with some background information about our agency. We are the European Education and Culture Executive Agency, EACEA, and together with other 5 agencies, we are in total 6 executive agencies, we implement the programs delegated to us by the European Commission. At EACEA, of course, you can deduce from the name, European Education and Culture Executive Agency, we follow mainly programs in the field of education and culture, audiovisual, citizens, active citizenship, solidarity. So these are our main programs. We have been established in 2006, and as I said before, we manage several EU programs in this field. And Erasmus Plus is the main program, the main action that we follow. These are just some basic background information about the Erasmus program that I'm sure you know already because you've been your project has been selected. These are the 4 main horizontal priority: inclusion and diversity, green, digital, and active participation. And this is the structure. You see that the action under which your project has been selected, Alliance for Innovation, is within Key Action 2, cooperation among organization, institution, partnership for innovation. Within the Alliance for Innovation Action, there are two lots. The blueprint lot is the Alliance for Sectoral Cooperation on Skills. For your information, this call, the Alliance for Innovation, Lot 1 and Lot 2, is quite a popular and highly competitive call. In this format, has been launched in 2021. And there were always really a significant number of applications. For Lot 2, we selected 7 projects in 2021-2022, 5 in 2023, and 8 last year with your project as well. So I think you deserve, as all the other projects selected, a slide of congratulations for having passed this tough selection. And here in this slide, you can see all the projects which have been selected since 2021 in all the various ecosystems. As my colleague from the Commission was saying before, in the health ecosystem, since 2021, there were 4 projects selected, 2 last year, 2 in 2024, your project, and also another project called Bright Skill. And then in the previous year, LD Care and Be Well. And then you can see all the other projects, a total 27 projects selected since 2021 in the various ecosystems. But now let's have a brief look about the key element, the key points of blueprint projects, of your project. So this, of course, as you know well, these are large-scale projects that promote sectoral cooperation on skills, so boost innovation, with the main aim to develop and implement strategy to address skills gaps in the various ecosystems selected. So they were introduced in 2016 with the launching of the skills agenda, as my colleagues also previously mentioned. And the main actors are business, SMEs, trade unions, research institutions, education and training entities, and public authorities. The main characteristic, they are 4-year project and with a very close monitoring, because there are 4 reports. I will explain it later, with a maximum budget of 4 million. And since 2021, with the lump sum grant. So you're not, your budget is not based on real cost, but it's based on lump sum associated to work packages. So the quality of deliverable and the completion of the work package is a key element for this project. As regard the consortium, there are always big consortium, like in your case, there are minimum 12 partners, is an eligibility requirement, and from 2024, only registered members of the Pact of Skills are eligible. This we know well, because of course with the coordinator we had to revise slightly the partnership for this reason. But not only in your case, also in other cases. For 2024, since it was the first year in which this strict requirement was included, we had to readapt slightly some partnership. And as I said before, these projects are the characteristic of this project, that we really do a close monitoring, also compared to other projects, smaller projects. And we do this close monitoring, close collaboration with DG Employment. And the responsible DG, like the colleagues just intervene, responsible for a specific sector. And often we have meetings virtually in person with the consortium. There's a report each year. The most important are the periodic report on the 2nd and the 4th final year, because also they are associated to payment and their specific circuit. I will talk about it later. But also on the 1st and on the 3rd year, there are some technical progress report that the coordinator should submit in the system as deliverable, that we added in the grant agreement phase. So these are important. So there's a continuous, basically, reporting that should be done. So one each year. And also there are flash report, the so-called flash report. They are very, light, brief report that the coordinator should send us and also to DG Employment, very important, every 4 months for regular brief update about the project. Also, a characteristic of this blueprint monitoring is that we involve external experts, which have really an expertise in the field for the project reviews. And we have project reviews every time there is a periodic report associated to payment. So in the second year and the last year. And as I said before, we have also every 4 months flash report. So it's basically intense monitoring with quite some work to do, also to report to us, that the coordinator will have to do to report to us about your activities. And then about your activities, so what is requested, what is expected. This is what is also written in this slide, what is written in the program guide. Of course, every project has its own activities, its own approach, but what is really required by each blueprint project is to develop a strategic approach to sectoral cooperation on skills, and to design then core curriculum and training programs within the first year with a reactive response, addressing urgent skill need, but also mainly throughout all the project. So delivering core curriculum and training programs in the field. And what do we do to monitor your project? We check your activities, we check your deliverables, and we check that the activities are implemented as described in Annex 1 of the grant agreement, which is the final part B, basically, that you have submitted with the application that you have the coordinator slightly revised during the grant agreement phase. And technically, this is a more technical slide that we have, but I think can still be useful for the coordinator and for the partner to understand how we follow the project. We have in the e-grant system this tool, this continuous reporting module, and the periodic reporting module. The periodic reporting really is linked only to the payment, to the pre-financing payment, to the final payment, while the continuous reporting is always open. Is activated at the start of the project after the signature of the grant agreement, and it's up to the coordinator to complete all the tabs in the e-grant, to update all the section, and to submit all the deliverables. This is the most important, to submit all the deliverables by the due date. Of course, as already mentioned to the coordinator, it is always possible that you have some delay in submitting some deliverable. You can always request me, since I am your project officer, your project advisor, to postpone in the system a date if it is duly justified. If for some reason you don't realize it on time or that you are late, then I will not be able to change anymore the date after, but you will still be able to upload in the system the deliverable. There will be let's say a red mark, say pending deliverables, and it would be necessary that you submit the deliverable as soon as possible. Try not to have too many pending deliverables, not to wait the last minute to submit all your deliverables, because of course this could give a bad image at the moment of the reporting. So try to be on time on your delivery. This is very important, especially because your project is a lump sum project. So as I said before, is not really, we don't really check invoices, we don't really check real cost, we check the quality of the content of the deliverable. Also checking, of course, the format used, the level of dissemination, and all the also formality as well. So it's really important the quality of the deliverable. We check it, we accept it, or we send it back when there is something to change. But the very final analysis, approval of deliverable is done, of course, at the final periodic report stage. Of course, the deliverables are outputs like publication, brochure, toolkit, and book. And of course, the project, of course, also in yours, all the partners are responsible for different deliverables, but it's only the coordinator who verify them and also submit the deliverables in the tool. As I said before, in accordance with the schedule set and via the continuous reporting tool. And a question that I receive frequently is that if in one deliverable there are several files, of course you can upload it in a zip file. Please pay attention in all the deliverables to respect the Article 17 mentioned in your grant agreement about the visibility and quality of information, the disclaimer. There is a specific logo and a specific disclaimer that you should include in all your deliverables, especially the public ones, please, because then they will be published in the Erasmus project result platform once they are finally approved after the final report. So it is really important that they are, of course, of good content and also in terms of form, respecting the logo and the disclaimer requirement. So this as regard, let's say, the continuous reporting and the deliverable that you should continuously upload in the system. And then we have also periodic reporting. The periodic reporting is linked to the pre-financing payment. You already have received the first one. And then there will be a second one after month 24. And then, of course, the final balance at the end of the project. The coordinator will receive an email that will launch all the action that you should do to be able to write, to include the periodic report, to finalize everything in the system, and then to submit it to us. And you will always, the coordinator will always have 2 months to do this once from the moment basically the periodic report is open at this level. At the same time, as I said before, there are 2 progress reports after the first year and the third year without payment that are already can give us already an idea how the project is implemented, and these are simply submitted as deliverable. And you will find here the template for all this report, for the one which of the first year, the progress report, but also for the periodic report. And then for the periodic report, you will have other action to do in the system, and we will be able also to explain you also in bilateral meetings how to do, but it's a very simple process. These are all useful links that you could use, that the coordinator could use. Of course, this process is mainly in the hands of the coordinator, but it's important that I think all the partners are aware. And after this, I can only tell you thank you, good luck, and of course, as project advisor following your project, I will be pleased to be in contact with you, to follow your project, and to provide you any support to any possible question you may have.
Thank you so much, Cristina, for your presentation. It was very helpful, and also is a very good point because, like, all the time I told, we needed to have like very good deliverables to have a handover. You basically reinforce this information. Thank you so much. And now we're passing over the next speaker on the agenda. Would like to invite the XiA coordinator Henrique Martins to set the scene of the project and then finalize the first session. Thank you so much.
Thank you, Anderson, and thank you very much for the colleagues in the Commission for joining us and taking the time to help throughout our project. It's my pleasure to close the opening of the session. It's of course my pleasure to welcome you all to Iscte. Those of you that is the first time, I know you got lost. That's part of our welcome pack, so that you explore the university by yourself. And the third note is, of course, to thank my amazing team. Our team is growing. Maybe you have had the chance to look at our mini website. I don't know, where is Shayla? Let me see. Shayla, thank you for helping us go into Brew. Brew is the business research unit, and within that we are now home. We now have a home, and our group is what we call Broody. Because it's Brew Digital Health International, so it's Broody. Don't ask me, George. Don't ask me the meaning of Broody. Okay, I'll tell you the meaning of XiA in a second, but not of Broody. but we can start to look at it. We don't have a logo yet for the team. I thought about a teddy bear because Brudi reminds me of teddy bears, but anyway, we'll come into that. And as promised in December, some of you are here, we now have Juliana in our team, and Uleta, can you please raise your hands in our Brudi? So we are going gender balanced a little bit further because we were only 4 guys, and now we are 6. And of course, we also have other colleagues from Iscte that are participating in the Iscte team. So I just want to highlight that, of course, there's a core team that mostly was responsible for organizing the event. But there's also Ana Lucia and Elizbieta. Where is Elizbieta? Was in the room. There she is, which will also be helping us, and you've seen them online. So with all the thank yous and welcomes, the final thank you to Simon that put up the slides. Well, put up and did the slides, okay? And is behind the scenes and in front of the scenes, as you can see there. So, so for me, is to set up the scene for the Innovative Alliance, and I really like to highlight this aspect of the project because sometimes because the funding scheme is called Erasmus, most people associate the word Erasmus with universities and students moving around, right? I mean, the brand Erasmus has been associated in our brain with students. Some of us have benefited from Erasmus somewhere in their life. Who in the room has had personal something through an Erasmus project? Yeah, you see the impact of the Erasmus grants is tremendous. Now, this Erasmus is not to move people around, you know, and go and study elsewhere for 3 months and go to the sun in Lisbon. It is to actually create an alliance between universities, companies, and other parties of the ecosystem. So the first thing I want to highlight as we start is that we need to start immediately to create this gigantic alliance. And it's a very simple mathematical calculation. If we add 1 activated partner of the alliance per week, we will end the project with 200. Now, if 200 partners in Europe train 100 people per year, this means 20,000 people. But if you use the numbers that the Commission just shared, that we're supposed to be training adults in a percentage of 60% of adults should be doing some sort of training, this is a very small number. And we don't have the numbers. This is maybe something we need to do in Work Package 3 or everyone, which is how many people in IT companies, for example, do some sort of on-job or education. Not before they start to work and they are employed, but after they're employed. And the same goes for IT technicians, for example, in hospitals. My experience when I took over as president of shared services in Portugal, all the IT staff had not done any training 2 to 3 years before I arrived. All of them. We're talking about 100 and something. Now there are 600 of them. Anyway, so this is my first point. Now, okay, we form an alliance, but what do we do with them? Right? What do we do with our allies? And this is what we need to discuss in the next 4 years, I guess. So you heard about these immediate timelines in terms of the European Health Data Space. So it's coming, and it's gone, but it will come back. It's coming, so that is important for us. When we wrote the call, it hadn't been approved. We sort of thought it would be approved, but if you think about it, last year in February, we were not completely sure the European Parliament and the Council would approve this regulation. It was a proposal. Now, you know, it's very interesting. We are set to go, and there will be online sessions and so on. And it was really interesting to check that there are legal articles covering training of both professionals and awareness, let's call it this way, for citizens. And then it's in the preamble, not as an article, that the training of the IT people that create the systems and the services is provisioned. which is pretty interesting if you stop to think about it. So the regulator is worried that there's no education for the health professionals using the European Health Data Space, but whoever wanted to put that as an article had to face that the same concept was actually diluted, and it's not even very clear in that preamble that we are to train also the people that create the European Health Data Space and the services. And I was just commenting with the Vice Rector that there's a sort of an assumption that IT companies and IT teams in hospitals and other healthcare professionals would know how to do it. And this is the most ridiculous assumption. Why would they know how to develop systems according to a European format that has never existed before? I mean, whoever forgot this, we will fix it, okay? We will fix it. But because you don't have to have a regulation to do things in life. You just have to want to do things in life. But in any case, you've seen the regulation. So now there's two interpretations of this diagram. There's the interpretation, there's only 4 years to go, so we still have a lot of time. And the other interpretation is, if you want an IT company to be ready to produce CE marked software compatible with the European format, it has to do that 1 year before the deadline, and it has to be able to code or recode their systems. And the people coding and recoding need to know what to code and what to recode. And those people need to have some training. So if you give yourself 1 year for each of these 4 parts, next year, many people in IT companies around Europe should be learning about things. And hence we are kind of on time. Who are we? Well, I think you sort of know who we are from the list, but it's always good to see ourselves on the map. It's always good to see ourselves on the logos. If there's any logo missing, it was not intentional. It was just the fact that we have an overloaded of work team, and sometimes things might get forgotten, but we will never forget anyone. So if we forget a name of your institution or a logo of your institution anywhere during the next 4 years, it is not because we want to forget about you. It is because we couldn't remember, which is a slightly different thing, okay? However, so you see, so we go from Cyprus to, well, Iceland is not yet there, but one day we'll get there, all the way to Ireland, from Madeira there, because it's also part of Portugal, to all the way up to Norway. I think it's pretty good coverage. I mean, we're missing a few countries, and my wish is that we quickly get associated partners in all the remaining parts that we are missing. And Anderson is already on track on this. I will show you his preliminary results on the first month as we move forward. I think you know the objectives, so I'm not going to go into the detail. I'll just highlight that for me, XiA comes down to 2 little things. Having a bunch of easy to understand, easy to aggregate and disaggregate in multiple learning models and multiple learning experiences, of learning blocks that put together allow people to create the components of the European Health Data Space. First one. Second one, have an alliance of companies and universities that are willing to use these materials in their training programs, both inside companies and inside universities, both for undergrads, master students, and of course, people working and working in the real life. So these are the sort of the 2 deliverables. Uleta, early today, she was already wanting to start designing the final website where you could go down and say who you are, and then what type of competencies you want to achieve, and then it would pop up how many blocks you should read, and what are the optional blocks you can take, and how many credits you would get. So I told her, yeah, go ahead, and if you have it done for tomorrow, we will be very happy. But so it's just to tell you that we have one person already sort of seeing this thing at the end, which is also good. And then I forgot when I was listing the partners, public authorities. So we also have some public authorities, and we are trying to get more public authorities as associated partners. And here we also have tomorrow in the program some professional associations. When we wrote the call, we talked about professional associations in a very generic term. Now we know that especially anything to do with training, for example, of health professionals will benefit tremendous from us forming alliances with medical, nursing, and other scientific societies. So as an example for that, tomorrow we'll hear from one of such societies in digital radiology that are willing to work together with us and co-create learning experiences for radiologists. Why is this important? Because if we're going to change the way medical imaging reports are to be made, we need to align this with clinical guidelines for radiologists. So if we are successful on this, we not only create material for those designing and upgrading the softwares they use, but also upgrading the people that use them. If we don't do the two at the same time, we're not as effective. If we do them together, we will be much more effective. So if the radiologists requiring a new upgrade in their hospital say, oh, but I want a software that covers these aspects, because I know I've done my training, my XiA training, and I know that I will have to report in a structured way in this way. So my software has to support what I need to do, and I need to do it because there's this clinical guideline approved by the doctors such as me. This is my hope and dream, and I think, at least with the imaging part, we are in a very good track to do this. In other areas, it's a little bit more difficult. Okay, so some synergies from past projects. I think there's more synergies that we need to map. So this is something that we could discuss together as a consortium. What other project we can take out? So tomorrow in the framework discussion, XiA framework discussion, we need to identify. I mean, these two are obvious, Xpand and XiA, but there's others projects, namely, for example, regarding data quality from Quantum and other projects that are ongoing. And then, so she is in the news today, both in France and in Portugal. So you can see that our wonderful communication team and Iscte official communication from the deanery did its work. So we have, I don't know if you know these cities, but they're somewhere in Portugal. Good food in Coimbra, good food in Viseu, very good food in Leiria, and the sweets, the eggs from Aveiro. So, and then you wonder, why would these people need to know this? Well, Aveiro has one of the biggest universities that produces IT people in Portugal, for example, and Coimbra is the third largest city in Portugal, but it's also one of the oldest universities in Europe. You might not know that. And we have partners there, and so on and so forth. So we, of course, would like you now to use also, but this is with the topic for communication, please reverberate the press release. I mean, EU projects are not LinkedIn projects. So EU projects are not won by having a lot of congratulations on LinkedIn. A lot of thumbs up by your friends. It's good. And when we're down, Sunday morning, if you're down and you don't know what to do, and you need someone to make a bunch of comments, you just put something about XiA on LinkedIn and you will see. People will say, oh, great job, great job. It's important to teach about standards and continue the good work. But it's pointless for our purpose. Our purpose is that the CEO of companies tomorrow go back and ask, do we have an internal training program? If so, do we cover these topics? Can we benefit from these materials? Can you redesign our internal program and consume these XiA learning blocks? That is success. Having a bunch of friends telling us that the project is looking cool is useful. And sometimes I think it's worthwhile, but it doesn't make us win. So we will need to go down or up, whatever you want to put it, to all the towns, not just these 4 in Portugal, but to all the places, and you will know better than us, where in Finland, in Germany, in France, and elsewhere are the, it's a bad expression, but you understand the meaning, where are the Silicon Valleys of Europe? Because we will need to tackle those to address companies designing systems for the European health data space. And what are the key universities that provide education that could also be impactful for that? But in any case, congrats for that. And then finally, as we mentioned to you, now this is a stupid joke, what I'm going to say. Are you ready for a stupid joke? So I've done an executive order, then my first executive order, inspired in the new trend of the executive orders. And I told Anderson that he can put in XiA whoever he thinks is a good partner. He doesn't have to ask at least me. Now, of course, this is to be voted by all of us if you agree with this approach. But I think he has the wisdom to know if a partner is a good associated partner or not. So we can allow him to do at least that first conversation. So far, we have been talking with the guys from the Radiology Society, a company, for example, that I think some of you might know, is Firely. It's a company that works on promoting fire. HIMSS, I think everyone here might know what HIMSS is, but some might not. And with this, I go to the last point of my talk. And then this one for me is difficult. Huh? Okay. It's another university and then a public health association. So these are just examples. Well, these are not examples. These are the 5 organizations with which we've talked in the last few weeks. But each one represents a different group of partners that we could include. It also represents that this particular consortium has a hybrid of people that know about pedagogy and know about teaching and know about education, and people that know the content matter, the standards, the format, and blah, blah, blah. So it is not obvious, it doesn't have to be obvious that everyone, for example, knows how important IMSS is if you want to impact, for example, health managers, IT managers, I wanted to say. So it's something that is very important for CIOs and health managers, IT managers. And they are willing to help us and also share their experience. They also have a sort of a HIMSS Academy and Learning Center. And again, here, putting our materials there could make sense. And I guess that's it. So we want to grow the Innovative Alliance. So if you know of any university, company, public authority, medical or nursing society, or scientific society, just drop Anderson an email with the name and the email of that organization. That is a very good question, but yeah, but I don't think we need to for the associated partners. There are rules. So Israel many times is part of European projects. Yeah. Yeah. So if they are within the list of countries that Anderson and Cristina can find, which I don't know by heart, don't ask me, then they can be associated partners. If not, we will need to create another thing, which we will create, some sort of extended alliance. There's an Alliance Plus already, a nickname by Anderson. We will create another fiction because there's one thing we know. Associated partners are much more powerful because they connect more with the project. But Anderson cannot change the grant agreement, and you will not want to sign the grant agreement every week. So we were thinking of doing is 2 times, right? So we will have these partners, hanging around, and then we will officially put them into the project 2 times, and that's it. But in the meantime, we need to find ways to grow the alliance. But we will have time to discuss this. the reason the reason I wanted to start with this topic is because I think online we have been discussing the educational aspects. And I want to highlight that there's two things we need to do. Two things. If there's two things we need to do, a logical, comprehensive, segmented content and materials of education, what we would call XiA learning blocks or whatever we need to call them. And someone, an alliance of people that uses them. These are the two things we need to build. It's very simple. A bunch of blocks and a bunch of people using these blocks. It's very simple. Now, Georgie, so there's two problems about this slide. This slide is credited to Anne Moon and Georgie because, and Eva, because the question is, what is the meaning of XiA? And of course, you would ask the question, well, what is the meaning of XiA? So yeah, last year when we were doing a final closure of Xpanding Age, we found this book in Iscte library, in the Iscte club, and we found it very funny. Took a picture, so we decided to put it here for you. So there's been written a book already about XiA. Can you believe that? And it was already in Iscte. And then Georgie was saying, well, what is the meaning of XiA? And I said, well, let's check for the internet. Maybe it's a Chinese word. Let's try. And then it came out very positive. Look at how lucky we were. It's a gender neutral, always good in today's world, right? Gender neutral name for Chinese origin, which means summer rosy clouds, which honestly I don't know what is a rosy cloud, but then something positive, right? And then great and grand. So I think this is what we need to do, something great and grand for Europe. And thank you very much for this.
Thank you so much, Henrique, for the final speech in the opening session. It was very inspiratory, and also with the meaning of the XiA. Now, we would like to say thank you also for the audience that have followed the meeting till now. So we'll close the session now and have our internal part of the meeting. So thank you so much for being online with us, and see you soon on the education about the classifications looking at Zomed session that will be held on 5:20 Portuguese time. Thank you so much.
Thanks to you. Very interesting.
Thank you. Yeah,
Thank you.
Bye-bye.